When is the best time to start pelvic floor therapy during pregnancy? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a great question, and it's one that we get quite often here at the Healing Spot. People calling in and asking when is a good time to start, or they're experiencing some things and they're like, is it too early, or have I missed my window, anything like that. So this is a great video if you are currently pregnant or planning to become pregnant. You may be wondering, if you've heard of pelvic floor physical therapy, when is the best time to start? So I'm going to answer that in this video. To be honest, the best time is depending on what you're experiencing, if anything. So a lot of times you may be experiencing some changes in your body that you know is related to pregnancy. So maybe it's pain or changes in your bowel or bladder function, which I'll go into in just a bit. But we get a fair number of women that reach out and they're not having any signs or symptoms that something is off or that something's wrong or that something they need to work on or fix. And they reach out and they're being proactive and saying, you know what, I want to prepare for a natural birth. I don't want a C-section. I don't want medications. I really want to do all that I can to prepare for birth. And I will say, it's never too early. You can start even if you're not experiencing any symptoms or signs that something is off. It's okay to reach out and get an assessment because I think that gives you some peace of mind. It also gives us a chance to get familiar with you and baby, and we can better guide you during your pregnancy. So we see people even pre-conception that come in. So it's never too early. But I want to talk to you a little bit more about if you are experiencing some signs and symptoms, I would recommend get in sooner versus later. Let's dive into some of the symptoms that you might be experiencing that warrant a closer look at things. One would be pain. A lot of the common things that we hear from our pregnant patients would be pain at the pubic symphysis. So into the front part of the pelvis. So I'm going to show you this pelvis here, but into the bones into the front here. You might be experiencing some pain into your lower back, or maybe even into the SI joints. Those joints are over here along the side, just under the lower back. So it might feel like the top of your buttocks or the top of your hip if you're experiencing pain there, or anything that goes into the glute area, okay, into the backside, into your buttocks. You might even be experiencing some hip pain. So I would say if you're feeling pain at all, that's your body saying, hey, something's off. Okay, and getting it checked out, especially if you've tried maybe some quick stretches or things at home and it's not working and it's persistent, get it looked at, okay, because there's no reason to suffer. The other signs and symptoms that I would look for are any changes in your bladder. So that could be something like feeling like you're starting to leak a little bit, or maybe having some urgency where you feel like as soon as you get the urge to have to go to the bathroom, you feel like you don't have a lot of time to get to the bathroom. Maybe you're experiencing some leaking with that or accidents. Maybe you're wearing a pad as a safety net against some leaking, and maybe not. Okay, maybe it's just the urgency. And we expect that to some degree, but I would say that's another thing to get checked out and see if there's something that we can change as far as where baby is positioned, or even the alignment into your pelvis that may be influencing how happy your bladder is. The other sign or symptoms that I would recommend to pay attention to are any changes in your bowel function. So that would be any changes in your bowel movements. Okay, so if you're feeling especially more constipated, like you're not able to go, you're not emptying your bowels as well, that's something that pelvic floor physical therapy can help. Hemorrhoids, if you're experiencing that because of all the increased pressure into the pelvic area, again, something that we can help with. And even things like leaking. So leaking of feces where you feel like, oh gosh, heaven forbid that you're having some accidents or maybe smearing into your underwear, or even loss of control of gas. So when you feel like you have some gas that you aren't able to hold that back. Those are all signs that the pelvic floor is not functioning as well as it could be. So to reiterate, if you're noticing any changes in your bowel or bladder function or pain, I would recommend get in sooner versus later, because those are things that you don't need to suffer through. Those are things that can change during pregnancy. So we don't need to blame it all on baby. There are things that we can do. And if you are that type of person that just wants to be proactive and get in and see where you're at, even if you're not having any of those signs or symptoms. Your body may be off, okay, and it's just not giving you signs or symptoms yet. So I want to talk to you real quickly about what we do here at the Healing Spot in order to assess what do we do to look at what might be going on. So one of the biggest things we look at is just mobility and alignment of the pelvis. So we do that with you standing up, with you lying down, and we're really checking to see if the pelvis is balanced side to side, front to back, as well as we have adequate mobility around the pelvic area here, because that's going to influence how baby is positioned and how comfortable you feel into your body. Another thing we check are the uterine ligaments. So you've probably heard of the round ligaments. They come from the front of the uterus and they come down into the front side and they attach onto the labia. So you might have some pain or feeling some tightness into the front side. Also, the broad ligaments come on the either side from the side of the uterus over to the inside of the hip into this area. There's one on either side. We also have the uterosacral ligaments, which come from the back side of the uterus, and they come down and attach onto the sacrum itself. So we look at uterine mobility because that's going to influence, again, how well you feel in your body and how baby is positioned. And that can really influence how comfortable you feel during pregnancy and even some of the changes into the pelvic area. The third thing that we check are the pelvic floor muscles from underneath here. And that's something that we can do from the outside, meaning we can press into the sits bone area, even into the lower back. And we can do that with you on hands and knees, sitting, even on your back. But then if it's warranted, we can talk about a internal pelvic floor assessment. So that's basically going intravaginally and checking what those muscles feel like, how strong they are, but also how flexible they are for birth. One of the things that I love to do with our mamas around 37 or 38 weeks is pushing practice, where we actually check in different positions how well mom is able to push. And we can work on that if you're not quite getting it, because the time to practice and get that down is during that last part of pregnancy versus being in the delivery room or being at home in that home birth and trying to figure it out. So that can give moms a lot of peace of mind and a lot of confidence as well. So what we do here at the Healing Spot is we really assess to find out what might be going on, especially if you're having signs or symptoms. We would also be looking at that even if you're not having symptoms, because we want to help you prepare for a smoother delivery and birth. So depending on what we find, then we come up with a customized plan. And really it starts with the assessment so we can find out what's going on. And then we would talk to you about what we're finding and talk to you about what we're going to do to fix things. So it might be doing some hands-on work that we're able to help your body get that better mobility or get better balance. It might be stretches or strengthening exercises. It might be breathing type work, that pushing practice. Okay, so we customize that based on what we're finding and based on your goals as well. So what I would recommend if you are watching this video and like I said, you're currently pregnant or you're planning to become pregnant, you can reach out to us here at the Healing Spot. We are so happy to answer any of the questions that you have and give you some reassurance, especially if you're finding some of those signs or symptoms. You can head to our website, healingspotpt.com. Pick whatever option works out the best for you. I recommend request a discovery session and sit down with one of our specialist physical therapists so you can talk about what's going on and see if we're a good fit to help you. We do this day in and day out, and we would be so honored and so happy to help you as well. Thank you for watching this Ed Talk. We will see you on the next one.